Hi, everyone. Thanks for joining GeoPoll's webinar. We're going to be going through some of our recent studies that we've run on coronavirus in sub-Saharan Africa. I am Roxana Elliott. I am the Vice President of Marketing here at GeoPoll, and I also oversee our internal studies that we do, such as the few that we've run on coronavirus so far. And I'm joined by John or JP Marunga, who is our Regional Director for East Africa, based in Nairobi, Kenya.
Good morning, good afternoon to everyone who's on the call from whatever time zone you are in. Thank you so much for joining the webinar. I'm happy to share with you the results of the second wave of coronavirus study that we've been doing.
Great, so we will get started. So as I mentioned, we will be going through GeoPoll's studies on COVID-19 in sub-Saharan Africa and some of the impacts it's already having on the ground. And as I said, joining me is John or JP Marunga. And to go through a brief agenda, we will be doing a short overview of what GeoPoll is, how we conduct surveys remotely through mobile-based methods, and then we'll dive into the study, going through first the methodology and then giving you some of the highlights of the study results. And we will leave plenty of time for Q&A at the end, so you can ask questions in either the chat, or there's also a separate Q&A box, which should show up at the bottom of your screen, but either the chat or the Q&A box is fine, and we will get to them at the end. So with that, I'll hand it off to JP to go through an overview of GeoPoll.
Thank you so much, Roxy. So just giving you a quick overview of who we are, how we do our research for those who probably have not interacted with GeoPoll before. We are a mobile survey company, fully fledged research agency that helps clients across the globe, mostly in developing markets. And we have our offices across different places in the world, with our biggest office being in Washington, DC and in Denver. Across Africa, we have our biggest operations office in Nairobi that covers mostly the Eastern Africa region. We also have an office in Johannesburg that covers Southern African region, and also have an office in Accra and in Lagos that covers the larger West Africa region, both Francophone and Anglophone West Africa. In terms of coverage across the globe, this map just gives you a quick overview of markets where we have done work or completed projects before. As you can see, we've covered most of Africa, Latin America, and Asia as well. We have a database of about 250 million mobile subscribers that we actually use to run surveys through. We've done very many interviews over the years, 10 million over the past year. And out of our database, we've indexed or profiled about 5 million respondents that we are able to run surveys with. And we've been able to support clients across the board through multiple survey platforms, which I'll be speaking to shortly. But at the center of it is the mobile device. And we all know how important the mobile phone is. So just a few statistics, or just two interesting statistics that you can look at when you think about the mobile device. In the next slide. Africa currently has about 774 million SIM connections, which is about 74% penetration for mobile device, according to the GSMA Mobile Economy Survey done in 2019. And it's estimated that about 483 million mobile subscribers will be connected to the internet by 2025. So that makes the mobile device a very important component in how research is done across the African continent. And we've been able to utilize this in the different modes that we run surveys in. And I'll be sharing that shortly in the next slide. So the way we run our surveys, we utilize multiple modes, and I'll just talk about that shortly. But that allows us to customize research needs or research studies to different client needs. The fact that we have a very huge database of respondents, and with the multiple modes that we have, we are able to reach a representative sample of respondents across the markets that we run surveys in, because simple methodologies like mobile SMS are able to be run on basic phones, and that allows us to have a lot of coverage, both from respondents that have basic phones and also those that have feature and smartphones. Our data collection also is run remotely, and that makes it faster to execute, and also overall, it's very cost effective and helps us to get around challenges that are very predominant in Africa, including poor infrastructure and challenges, for instance, around weather and that may hinder one from doing a service. And we're also able to go very targeted in our survey dissemination. So for instance, if you're running survey that is targeting particular demographics of interest, we are able to run surveys particularly targeting these respondent segments. So that makes the different platforms that we use very customizable and very effective in running surveys, especially in developing markets. We have multiple ways that we're able to run surveys. The simplest way is through a two-way mobile SMS. So this runs on any mobile device, from your basic phone to a feature phone and also on a smartphone. We are also able to run telephonic interviews. So basically interviews where interviewers call on phone, and currently we are doing that remotely. We have also developed a mobile application that allows us to run surveys online for respondents that have downloaded our mobile app. And that allows us to do a little more than mobile SMS. So for instance, you're able to test videos, test audio, and also evaluate images if there's need for that. Very closely linked to that is mobile web. This is where you run surveys through a mobile browser. The initial SMS going out as a normal text, but with a link, and the respondent is able to click on that link and take a survey. We are also able to run surveys, qualitative surveys through WhatsApp platform. That has allowed us to run mobile online qualitative groups. And then also, of course, right now COVID has prevented us from doing this, but we're also able to run in-person interviews. So this just very briefly just shows the different modes that we're able to run surveys in. And for this particular survey, and as Roxy will be explaining later on, we did run it through mobile SMS and mobile web in combination. Lastly, as we look at GeoPoll, just to give you a quick overview, is that we support clients across 3 different buckets. So we have clients in the commercial sector. We also support clients in the development sector, so UN agencies, NGOs, and the like. And we will also be able to work with other research agencies who use our platform to run surveys across the different markets that you operate in. So that quickly gives you a quick overview of GeoPoll as a company, and sets the tone for you to understand the basis for which we did the coronavirus series of surveys. Over to you, Roxy.
Great, thank you, JP. Okay, so getting into the study, this study was run in 2 waves. The first one in early April and the second one from late April to early May. And it was run in 12 countries throughout sub-Saharan Africa. You can see the list here. So we have a good mix of countries from East Africa, West Africa, and Southern and Central Africa. As was mentioned, this was run through SMS and mobile web. Mobile web was used mostly just for the more urban areas, so it was majority SMS. And the sample size was 400 per country per round, so we've had over 5,000 unique respondents who've participated in this study. And for the sample demographics, it was nationally representative in each country by age, gender, and location, with a natural fallout of LSM, which is a measure for living standard measures, or SEC, in all markets. And we do have the raw data available, as well as the detailed country-level quota breakdowns, and we'll give our contact information at the end, and you're welcome to have that if you would like to do additional analysis. So the first things we looked at were awareness of coronavirus and levels of concern in general over coronavirus, and we found that it was very high. 71% of respondents indicated that they are very concerned over coronavirus. And this was the case even in the first round, which took place really when the first cases were just started to be reported in some of these countries, but still clearly it was already a global event, so people were already quite concerned about coronavirus and its impact on their country. This statistic dropped in a few countries from round 1 to round 2. In Cote d'Ivoire, Zambia, and Rwanda, it actually went down slightly. That's likely an indication that those countries had a strong response to coronavirus. Rwanda, for example, we'll see in some of the other slides, people are quite confident in their government, and they had some aggressive lockdowns earlier on. So yeah, those 3 countries dropped from round 1 to round 2. And we then looked more specifically at if people think that they are actually at risk of being exposed to coronavirus. And this did go up a bit from round 1 to round 2. So in the first round, we found 63% thought that they were at risk of being exposed. And in the second round, that rose to 66%. This number was quite high in Mozambique, was one of the countries where it was highest, and it was lower in Rwanda. And then there was an increase in Ghana from round 1 to round 2, had the largest increase. And that was likely because Ghana had a partial lockdown that was in place when we first ran the first round of the survey, and then had stopped by the time we ran the second round of the survey. So people thought that they were more at risk by that time. We also looked at the most concerning single aspect of the pandemic. And you can see while contracting the disease itself was the highest, with 28%, saying that was their number one concern, the economic impact is just behind it, with over a quarter of respondents saying that that is their biggest concern. And we know that a lot of economies around the world are already feeling the effects of coronavirus. And this is certainly the case in economies in sub-Saharan Africa as well. Many countries rely on informal trade, which is likely to be quite impacted by lockdowns and other restrictions. So this was a very high concern to people. And we also looked in general at overall economic concern, and that was also very high. The next set of questions looked at testing, healthcare seeking behavior, and preventative measures that people are already taking to protect themselves from coronavirus. So in terms of testing, we found that it's actually risen over time. So this is an interesting statistic, given that we know countries all over the globe are trying to ramp up their testing efforts, and this is certainly the case in sub-Saharan Africa as well. Testing levels were quite low earlier in the year and have now risen a bit. So you can see in the first round, that was early April, 64% said they did not know anyone who had been tested. This dropped to 61% by the second round. And you can see the tested negative numbers increased from 12% to 16%, so indicating more people are getting tested even if they just have symptoms of coronavirus, but they're coming back negative. And the positive numbers increased slightly as well. And then in terms of changes in healthcare seeking behaviors, so we asked if people had mild symptoms of coronavirus, what they would do. And this was a quite interesting question, and you can see there were some interesting changes between the rounds on this question as well. So the options were go to a hospital, go to a doctor, stay home, or not sure. And we found that from round 1 to round 2, we saw some pretty large changes in some of these areas. So going to a hospital decreased from 58% who said that that is what they would do with mild symptoms to 51%. So still over half said that they would go to a hospital. Go to a doctor increased slightly from 25 to 27%. And staying at home increased quite a bit as well, from 12% to 18%. So this could likely indicate that communications around what people should do if they have coronavirus has increased over time. We know that In certain countries, people with mild symptoms are advised to stay home and self-treat themselves unless their symptoms get worse. So it could be an increase in communication. This could also be because of stigma attached with going to a hospital. Some countries have introduced quarantines if you are tested positive. So perhaps people are less likely to want to go to a hospital if they know that they may be under quarantine if they do have coronavirus. Next, we looked at what measures people are taking to protect themselves from coronavirus, and we found, even in our first round of studies, that almost all respondents said that they have taken measures to protect themselves from coronavirus. And then we'll go into the measures that they have taken, and here you can see that 54% said that they had increased hygiene. This includes increasing hand washing behavior, using sanitizer, anything like that. But also almost half of respondents have said that they are avoiding public places. Avoiding public transit and working from home were slightly lower percents. You can see 20% say that they are working from home, but in the next slide we will see, we actually looked then specifically at self-quarantining. So we found 71% said that they are self-quarantining. And the reason for that discrepancy between self-quarantining and working from home is likely that people are staying home but not able to actually work from home, or that was not their top preventative measure that they were taking. So yes, we found 71% overall had reported they are self-quarantining. This question varied quite a lot by country. You can see South Africa and Rwanda, which were two of the countries that had the earliest lockdown measures, had quite high percents who were staying at home. And Tanzania and Benin were among the countries that had lower levels of people reporting that they were self-quarantining. And Ghana, again, likely due to the lifting of the lockdown that had happened between these rounds, we see this had the largest decrease in terms of self-quarantining behavior from round 1 to round 2, going from 71% in round 1 to 64% in round 2. The next set of questions that we will go through looked at sort of secondary effects of coronavirus, including food security and changes in consumer behavior, such as shopping behavior and purchasing of non-essential goods. So food security is one of the greatest concerns to the international community. Many of the countries in this survey already have somewhat high levels of food insecurity. So we wanted to see if coronavirus has changed that. And we did find that 80% of respondents, so a quite high percent, indicated that within the 7 days prior to the survey, they had worried at some point that they would not have enough food to eat due to lack of money or other resources. And this did vary a bit from country to country, but quite high across the board in terms of worry over food availability. And we looked also at what food markets, the operations of food markets and how that had changed. And so here we found there were some shifts between round 1 and round 2. We found in round 1, 18% said most food markets around them were open. This actually increased slightly to 22% in round 2. And the same with most markets being closed. So 22% in the first round said most markets were closed, and 17% in the second round said most are closed. So it's a small shift, but it does seem like there's a bit of a shift from early April to late April, early May in terms of some markets reopening. But you can see the all are open option stayed at 20% in both rounds. So still 80% of respondents say that not all of the markets around them are currently open due to coronavirus. And then we looked at when people do shop for food and other essential items, how is that changing due to coronavirus and related restrictions? And here we found over half of respondents said that they have changed where they purchase most of their food and other necessities due to coronavirus. And we also found people are switching to cheaper brands at a quite high percentage. This question was asked specifically of the 80% who said they had been worried about food availability. And you can see in round one, 72% of those respondents said that they are switching to cheaper brands due to their concern over not having enough food. And in round two, that raised to 79%. So again, indicating people are concerned about the economic impacts, maybe trying to save money when they're shopping for food. And this is rising over time. And in terms of how often people are shopping, we found that almost 60% reported that they are shopping for food less often. This is likely due to being told that they need to stay home for most of the time or only do their grocery shopping once a week. So most respondents are shopping for food less often. And we also looked at the changes of purchasing for non-essential goods, and this was really way down. So almost 70% say that they are purchasing less in terms of non-essential goods, again, likely due to the economic impact that people are already feeling and that they anticipate to be coming soon. In terms of the pack sizes that are being bought, we saw some changes in this from round one to round two. So this question looked at the quantity of food and essential items purchased now compared to before coronavirus. And we found that 42% in round one said that they were buying bigger pack sizes, while just 23% said they were buying smaller pack sizes. And this is likely related to the question where they said they are shopping less often. But this changed a bit in round two. We saw slightly fewer, 39%, said that they are buying bigger pack sizes, and then a higher amount, 28%, said they're buying smaller pack sizes. So again, this shows there are some changes in shopping behavior that have happened even within the past few weeks. And I will now hand it back to JP to go through some questions on the government and commercial actions and changes in media consumption that have happened due to coronavirus.
Thank you, Roxy. Yes, so I'll be looking at those two aspects in the next few slides. So the first thing we looked at was the kind of confidence that populations have with the government in fighting coronavirus. And overall, over half of the sampled respondents across all the countries that we sampled say that they actually have enough confidence, or they're actually very confident that the governments are doing enough to stop the spread of coronavirus. And this showcased the central role that government plays as an actor in the prevention of coronavirus. So in the next slide, we see the different confidence levels that consumers have with their government across the different markets. Rwanda has been leading in confidence over the last two waves, though we saw a slight drop in this round, but still had the highest score in terms of consumers who had the highest confidence in their governments in terms of the fight against coronavirus. We also saw a great improvement in the confidence levels in South Africa over the last two waves. In wave one, the confidence was about 3.6 out of 5, currently at about 4.2. So it actually had the highest increase over the last two waves. And this could be, this actually could show that, some of the things that the government is doing in market is bearing fruit. We also saw certain, changes on the negative side in certain markets, with the key ones being in Cote d'Ivoire. Ghana had the highest drop, and actually we've seen also from the previous slides that Roxy had shared that even the concerns around populations being at risk of COVID-19 actually increased in Ghana. So that could actually be signifying something that happened in the market that shifted consumer perceptions around how the government is being prepared to fight coronavirus. Beyond that, we also looked at what other parties, populations thought should actually be at the center of fighting coronavirus. So the first sort of like body that consumers feel is responsible for assisting during this crisis is the government, but also NGOs, private sector, and different players within even the commercial space are actually being urged to be at the forefront of fighting the virus. So citizens generally look up to the government as the person or the body that needs to take the lead. However, what they are also communicating in this is that they need all hands on deck, because as we have seen, the concerns from the different markets are slowly shifting from, being, exposed to the risk of the virus, and to more around food security and, the challenges that lockdowns have presented to these different countries and populations within these countries. Lastly, we'll look at the different sources of information that people are actually using to get information around coronavirus. So across the two waves, TV remains the top platform that people are actually using to get information on coronavirus, followed by social media and radio. But this differs greatly across different markets. So for instance, in markets like Benin, social media is top, followed by TV and radio. In the likes of DRC, Rwanda, and Uganda, radio is really has been mentioned as a biggest channel that people are actually using to get information on COVID-19. And then in markets like Ghana, Cote d'Ivoire, Kenya, Mozambique, Nigeria, and South Africa, we see lots of communication through TV as well as social media. But starkly for South Africa, government messaging was also very high on this round in terms of the platform from which people are using to get information on COVID-19. And as we saw in terms of confidence levels in the government, we've seen that has increased on this wave. So there's definitely something that the government is doing in the market that is resonating well with consumers in there. We were curious on social media because that has stood out across the two waves as the key medium, as a key medium through which consumers are getting information on coronavirus. So we actually went further to understand within social media what platforms people are using to get information on COVID-19. And media outlets were the main platform within social media that people are using to collect information or get information on COVID-19, followed by health organizations and government. So those are the platforms within social media that people are using to get information on COVID-19. Lastly, in terms of changes in media consumption as a result of COVID-19, we see lots of 2/3 of the consumers that we sampled mentioned that they have increased their consumption of media over this period. And this could be, of course, linked to the fact that majority of people are staying at home, but also could also be could be showing the need for information. So people are consciously going online or going to the different media platforms to get information on COVID-19. But of course, we expect this to change in the coming weeks and coming days as government ease restrictions on quarantine and also lockdowns as a result of the need to open up the economy. So this is something that we'll be able to closely watch in the coming weeks as we continue with our series of surveys. With that said, Roxy will just take us through some of the next steps that we'll be doing from a coronavirus perspective in terms of what we are doing next, and then we'll go into the Q&A.
Great, thank you. Yes, so for more information and for all of our studies that have been run so far on coronavirus, they are all available on our website, geopoll.com. We have a specific page with coronavirus resources that should link to all of them, and we also post regular blog posts on our blog. And the full report, which includes the results from round 1, is also available for download for free. And there is also an interactive dashboard on the website, which allows you to filter results by country, age, gender, and also more specific location so you can really dig deeper into the data. In terms of what we're doing next, we will be continuing to run studies on the impact of COVID-19, and our upcoming one, which should be published sometime in June, is looking more specifically at the financial impact of COVID-19. So as we continue, we think that is going to be one of the biggest areas that people will be looking at. As we already saw, it was one of the greatest concerns that came up from these initial studies. So that is what we are running next. And you can also contact myself or JP through these emails. Again, if you would like access to the raw data, it is available. You can email me to get that, and we would be happy to send it over. And now we will go into some of the questions. So let's see. We do have data disaggregated by gender, age, and location was one question. One question is, do you know if all receivers of the SMS were literate? Were they sent based on previous responses? And this is a question we get a lot. So yes, for this specific study, it was done through SMS and mobile web, which are both text-based modes. So respondents would have to be literate to read and respond to those. For the text message survey, one thing to note is it is free for respondents to both receive and respond to. GeoPoll has 0-rated short codes in all of these countries, so they can receive it even if they don't have airtime credit on their phone. But yes, they are literate. So this study does reach a literate population. A lot of the studies that we conduct, though, with clients, we do through CADI, which is computer-assisted telephone interviewing. As JP had mentioned at the beginning, we have call centers throughout the globe and several in sub-Saharan Africa that we conduct interviews out of. They are all running remotely at the moment, so the interviewers have actually been set up within their homes and able to still conduct interviews that way. And that is probably our most popular mode for reaching lower income and illiterate respondents. And as JP mentioned, in the past we have also done interviews through in-person interview, but of course that is not feasible at the moment. So CADI is a great mode. You can have longer questionnaires as well than usually in SMS. One question was about languages. Did you use local languages or only English and French? Yes, we did ask. We did use local languages, so it was run in Kenya, Rwanda, Swahili in Tanzania, French in the Francophone markets, and Portuguese in Mozambique. And we do offer multilingual, so respondents get a choice of what language they want to take a survey in. And yes, we do always translate our surveys into local languages. One question on, will the presentation be shared? Yes, we will share both the presentation and the recording of this. And how do you select your interviewees? Do you typically have a constant contact list, or does it vary from round to round or survey to survey? JP, do you want to talk a bit more about GeoPoll's respondents and how they're selected for surveys?
Sure. Yeah, so across the countries that we operate in, as I've mentioned, we have a large database of respondents that we have in store. So these respondents, we onboard them, and from an onboarding survey, we get their basic demographics. So the respondents are stored within a database with basic demographics in terms of age, gender, and region, as well as socioeconomic class. So when we are running our surveys, we pre-stratify the sample based on the national representative statistics for that particular country, and then a survey is sent to those respondents, and ensuring that the sample is representative of the population of the market. Over and above that, from one round to another, we keep the same profile of respondents, but we do not send the survey to the same respondents wave on wave.
Great. Thank you. And we had a similar question about representativity of a survey. So what population are you referring to, and how 400 respondents are representative? So this is a question we get a lot. Yes, it is nationally representative of the adult population. The source that GeoPoll uses for the overall adult population estimates and the breakdowns by gender, age, and location differs by country, but it's generally some sort of the most recent census information that we can find, and we can send you that information per specific country if you're interested in it. And the sample size of 400, so that is a pretty standard sample size across all sorts of market research applications. 400 gives you a 5% margin of error at the 95% confidence interval level for the statistical details of that. So it does seem small, but for market research and how it applies to the population, it does actually give you a relatively low margin of error, and it is considered an acceptable sample size for many, and that's pretty much any population. Once you get to 400, you cover any population. Let's see. How do we select the countries that participate in our research? GeoPoll does research really around the globe, but we do focus on the emerging regions in sub-Saharan Africa, Asia, and Latin America. And we do, so for this study, one way we selected the countries was just looking at the spread of where GeoPoll conducts work. As you saw from the map in that initial slide, we've conducted work in almost every country in sub-Saharan Africa. And these countries are some of the ones where we've done work most often. They also cover some of the key economic regions, such as Kenya, Cote d'Ivoire, South Africa, Nigeria, and we felt it was a good spread of different countries and population sizes. So that's how we got to these countries. And one question about data regarding the places consumers brought their foods. We did have one question that's available in the dashboard that looks at how people changed where they were purchasing food, and I believe supermarkets was the top response there. And we also have some more recent studies on our website, specifically in Kenya, looking at FMCG purchases, which look at places of purchasing as well. And that's something we could certainly look into further. See if there are any more in the chat. So one question is about, a couple questions about who we're going to share this research with and what it will be done with it. So this research GeoPoll conducted internally. That's why we're hosting this webinar, and we have sent it out to a lot of our contacts at various NGOs and governmental agencies. So then we leave it up to them to do what they will with the data. We have also shared it fully on the Humanitarian Data Exchange, and I know it's gotten quite a lot of downloads from there. In terms of more direct impacts, we also work with other clients who are looking more specifically at humanitarian needs, what aid is needed in specific regions. So that's the type of impact that this data can have.
Hey, Roxy, I also see questions around Uganda and Tanzania. I know they were there in the first round, and just to cover them in terms of why they were not included in this round is because of, as you probably know from people who are in those particular countries, is that those two countries have put in some restrictions around collecting data on COVID-19 and dissemination of the same. So we did exclude them in this current wave. However, the data for the first wave for those two countries are available on our dashboard.
Great, yes, thank you for that. And a couple questions about if we're planning to run around 3 for this study. So we won't be running this exact study again, but as I mentioned, we are running a study that looks deeper on the economic impact of coronavirus. We'll be running it in 5 countries throughout sub-Saharan Africa, and that should be released sometime in June, and we will make sure to send it out. If you are not already, I think everyone who's registered should be on our webmail list, so we'll send it out in our newsletter when we release that next study. And we welcome suggestions for additional topics as well. You can email either myself or JP, and we will certainly take that into consideration as we build our next studies. JP, are there any other questions you see that you'd like to answer here?
Just running through this. Yeah, there's a question in terms of if we actually had a question on access to water, not within this survey, but we had, if you look at the dashboard, you'll see there are questions around hand washing, and we've seen some slight drop in the levels of hand washing. So that data is available on the dashboard.
Yep, and one question about how we acquired the database that we have our respondents. I believe JP answered this a bit earlier, but GeoPoll acquires respondents through a few different methods. One is direct partnerships with mobile network operators, which allows us to send surveys to them. They are opted in to our survey service, and then they once they first take a survey, they're also profiled in our database, so we can target them more specifically by demographics. And yes, we can differ between rural and urban. As another question, we had a rural-urban specific question in this, which should be available in the dashboard. And then we also have a location by the first administrative district, which is often the state or province within a country. So you can drill down further to smaller areas within each country as well. We can also ask city location. We did not get further down in the location for this study, I believe, but we do often ask city or town as well. And yes, we will be holding more webinars. Probably the next one will be when we do release that next study on the economic impact that looks more specifically at those questions. I think that answers most of the questions. If you do, I saw some questions about more specific sample frame questions, and again, you can email me. We do have the specific sample frame per country, and we also have the source of the nationally representative statistics per country, so we are happy to share that with you, as well as the raw data, which you can use to conduct your own analysis. So I think with that, we will finish up, and please definitely email us if you have any questions, and we will send a recording of this around along with the slides. And again, you can find all of this information on GeoPoll's website. So thank you very much, and thank you, JP, for joining me.
Thank you, guys. Have a good evening and good day for those on a different time zone.
Thanks. Enjoy your day.
Bye.